Okay, thank you so much. So let's make a move. A very good afternoon to everyone sitting out there and watching this live session. I hope you all are doing good and healthy. As the third webinar of First Dialogue webinar series, I am really very excited to have all of you here. First Dialogue stands for Forensic, Intellectual, Research, Scientific, and Technological Dialogue. The main motive and the main aim was to ideate, innovate, and implement. So, I, Ragini Pandey, student, School of Forensic Science and Risk Management, RSU, on behalf of the team and department, welcome all of you on this session. Okay, so today's topic to be discussed is forensic neurocriminology, reasoning and rehabilitation. Neurocriminology is the subdiscipline of biocriminology and criminology that basically uses brain imaging techniques and principles from neuroscience to understand, predict and prevent crime. So to get just more knowledge on this field, we have amazing speakers, Mr. Mahesh Tripathi and Dr. Amory Y. Clarke. And see, if I say amazing, I mean it. So let's have a look on what specialties does our speaker have. Mr. Mahesh Tripathi is assistant professor at School of Forensic Science and Risk Management, RSU. Also, he is the Department of Psychology at RSU itself. So he has a varied experience of 18 years in teaching and industry. He has MPhil in clinical psychology and currently post PhD. He has interest and knowledge of working in the areas of crime psychology, police psychology, crime, and criminal behavior. Now, coming to Dr. Clarke, he has PhD in clinical psychology for USA. He has been lecturer at the university, at the King's College London University for the Institute of Psychiatry, Psychology, and Neuroscience. His main area of interest is the overlap between the criminal justice and the mental health services. Dr. Clarke is currently a consultant psychologist and head of psychology for acute, crisis, and complex care at South London and Maudsley NHS in Croydon. So just a bit housekeeping before we get started. Participants out there, if you have any query, like if you want to ask any question, please don't interrupt in between. You are supposed to drop your question into the comment box and I'll surely bring your question up at the end. Also, please write the speaker's name from whom you want to ask, as we have two speakers, so we'll get confused also. You are requested to please switch off your camera and mic, and please do not share your screen. Now, I would like to call upon Mahesh Tripathi sir to start the lecture. Till then, you stay tuned and focus. Thank you. Over to you, sir.
Okay, thank you, Ragini. Thanks a lot. So now I need to open my presentation. So before starting my presentation, on this occasion, I would like to thank our former Director and Research and Development, Dr. S.L. Vaya ma'am, and she is Sudhanshu sir. Okay, directly. Now it's visible. Okay. So, as I talked, this program was bring by our former Director, Research and Development, Dr. S.L. Vaya. I want to thank her. It was her vision to bring such new programs in India, especially in our university. On this occasion, I would also like to thank my former Director General, Raksha University, Sri Vikas Sahai sir, who has encouraged me, motivated me for its implementation in correctional settings. Now, we'll start with the terms. So, as I use the term forensic neurocriminology, we'll see one by one. There are several terms which are included in each other. These various terms are neuroscience. Neuroscience is a scientific study of nervous system. Criminology is a study of crime from a social perspective. Then neurocriminology, it's application of brain imaging techniques and principles from neuroscience to understand, predict, and prevent crimes. Now comes to forensic psychology. The forensic psychology, it's application of clinical psychology to the forensic arena. So why I have used this term forensic neurocriminology? Because the knowledge of neurocriminology and its application in forensic arena. As a forensic psychologist, we are using this knowledge, this understanding for forensic people. That's why I use this term forensic neurocriminology. So basically, this neurocriminology term was first used by Dr. Hilburn and laterly it was adopted by James. It was adopted by Arian Rain in Department of Criminology, Pennsylvania. Then in 1980, Dr. Rose and Hilborn has established in Cognitive Center of Canada in University of Ottawa in Canada, and this center has developed for the purpose to research and develop effective methods of reduction of recidivism, especially to reduce the repeat offenders. So this program was developed on the basis of analysis of 100 offender rehabilitation program. They have studied on more than 100 programs of rehabilitation, and they have developed a new program. This program is basically based on cognitive behavior-based therapies, and on the basis of 40 years of empirical research, they came to know like this accredited program teaches certain values, skills, which are antagonistic to antisocial behavior and essential to achievement of pro-social competence. These skills and values enables and motivates desistance from antisocial behavior. As we know, offenders are lacking in these skills. They have inadequate development in the skills to achieve pro-social competence. So these skills are problem solving, self-control, empathy and values, critical reasoning, social skills. So these are the areas where they are lacking, and this is based on long research on criminological studies, especially in neuroscience. It is found that they are lacking on these areas. So this program is basically target the skill and values that are antagonistic to antisocial behavior, and the skills and values enables and motivate them for pro-social behavior. This program target on individual characteristics. These are the characteristics, individual characteristics which are necessary for pro-social behavior. The one is like decision making. It is seen in the research that the people from offender populations are very poor in decision making. Then they don't have a proper impulse control. They are lacking in their impulses. That's why they are committing offenses. They are unable to empathize with others. They don't have any concern for others. So they are unable to understand others' feeling. And this program is making them to understand the others' feelings and concern, so they can think empathetically. They develop some healthy competitive abilities, and basically it is found that most of the offenders are working on the problem focus attitude. They are having problem focus or emotional focus attitude. So by this program, they learn how to focus on solution. So this program teaches them solution focused attitude toward problems, so they can come with some solution. They don't have much self-respect about themselves, so this program teaches them teach them and they will learn after how they learn about their respect. So they generate some respect about themselves. There are as per last report published by Dr. Rose, now this program is available in 16 languages, 16 different international languages, and it is applied in 24 countries, most developed countries like UK, Canada, USA, New Zealand, Australia, various countries, China, Japan, already have applied this program into their prison system. This program is applied to 90,000 antisocial youths worldwide, and now it's 32. It's implementing since last 32 years in different correctional settings. This program is applied in different correctional settings. This is two-type program, R&R and R&R2. R&R is reasoning and rehabilitation. That was the initial model. Later they came with a short version of reasoning and rehabilitation that is known as R&R2 model. It is like our cognitive behavior therapy. Clinical psychologists are more aware about that. Okay, there is a brief clinical cognitive behavior therapy model. So like that, this R&R2 model is also like a brief model of therapy. This can be implemented in wide variety of correctional setting and across the spectrum of offender types. So there are people like the youth, which is showing externalizing behavior, conduct disorder youths, delinquents or deviant behavior, adult offenders, alcohol and drug abusers. This can be used on this is basically made on prisoner population. This can applied on sexual offenders. This can applied on spouse abusers, white collar criminals, mentally disordered offenders, violent offenders. So variety of offender populations it can be applied, implemented. So this program are facilitated. This program can be facilitated by types of professionals like forensic psychologists, prison guards can apply, probation officers can apply, social workers can apply, clinical psychologists can apply, psychiatrists can apply, psychiatric nurses, occupational therapists, teachers, correctional managers, university faculties, research scholars. So variety of people who are related to the system, especially dealing with offender populations, can apply this program after receiving particular training. This program is basically targeting on the areas of self-control. Self-control, as we know, basically offender populations are committing crime because they are unable to control their self. At times, they are unable to control their emotions, like the basic emotion, anger, lust, or fear, they are unable to control, so they indulge in certain crimes. Metacognition, as it is a very higher level of cognitive functioning which is lacking in offender population. So this program teach about cognition to cognition or thinking about thinking, like that way. It's called metacognition. Certain social perspectives are taught in this program regarding their social values and norms. Then interpersonal cognitive problem solving skills. So when problems are arising in interpersonal relationships, how they can solve these problems, as already I speak in last slide, solution focused problem solving. So here this program taught them how to focus on the solutions and finding the new solution for that problems. This program also taught certain social skills like certain assertive skills, certain communicative skills, the way of speaking, the way of receiving, so certain social skills this program taught them. So critical reasoning, some creative thinking, and their value enhancement. So this program is basically targeting on all those areas which are mainly known as higher cognitive functioning. And research on offender population, especially in the neuroscience, have shown that these people are having deficit in their prefrontal cortex and amygdaloid. So if you see the functioning of prefrontal cortex and amygdaloid is related to, like, prefrontal cortex is related to the executive functioning, and amygdala is responsible for emotional understanding. So if both these areas are lacking in these people, they are unable to control their emotions at times, and they can execute on directly. They can execute on emotions, or they can execute on problems directly. So it will become unwanted behavior, you can say. So by targeting on these areas, we are mainly targeting on the neurofunctioning of that people. So gradually they will develop these things. How this model is implementing, this is very is like a precise model of intervention. So it requires a very small group, and basically this atmosphere is very thought-provoking, stimulating, lively, and debate-like, but highly structured and task-oriented. So every individual in the group is assigned certain tasks, and everybody has to involve in the discussion, and something like they will give the more detailed program will discuss by the Amory sir. So he will clarify the things. The average size of group is 6 to 8 people, but as per the situation, it should not be less than 4 or more than 10 people. So techniques. The program includes structured group activities, so highly structured. So basically, pro-social role playing. So certain role playings are assigned, thinking games, some puzzles and problems. Trainers can readily change the content and required to ensure that material presented is relevant to the group and is culturally appropriate. So whatever examples and the puzzles or role-playing items are mentioned in our program, that is based on the Canadian population. So we can change here, and we are working on that. We have changed certain things. So when we are presenting to our population, we are taking care that should be matching with their cultural and geographical background, so they can easily understand and they can participate into that program. Each program includes exercise in which individual participants practice applying the skills to their individual problems. Number of sessions not more are from 18 to 25. The session can be delivered in almost any schedule that suit the requirement of the agency. It's depend on the agency's requirement. The ideal is 2 to 4 90-minute session a week. So week may 2 to 4 sessions we can arrange, and it should be 90-minute session. Session is little long because there are exercise based. There are certain exercise, and every individual of the group has to participate in that exercise. Also involve out of class. There are certain homeworks also. So homework session may they have to complete and submit, like we are doing in cognitive behavior therapy, the same way. Each program enables booster or follow-up sessions are also available. So more on this techniques and methods and exercise, Dr. Amory Clarke will talk on that. Now I will say I'm talking about certain evidence-based evaluation on this program. So R&R is one of the most frequently evaluated program in correctional setting. Its efficacy has been examined in a remarkable number of independent international evaluation, not only in Canada where it was developed, but also in California, Colorado, Georgia, Texas, Germany, Scotland, Spain, Sweden, and in the UK. Several other countries are also working on that. It is clear that cognitive model and the RR program has been well received in the criminal justice community. The enthusiasm has been reinforced by evidence of its efficacy in a variety of settings with a variety of types of offenders in a variety of countries. In 2017, they have a review of 50 international evaluations. R&R2, both programs can significantly and substantially reduce recidivism when conducted properly in a conducive ecosystem. If a program is applied in a proper system, like in proper way, then the efficacy rate is so high. R&R2 programs were designed to provide shorter, theoretically sound and practical ways to motivate reluctant, resistant and ambivalent clients. Basically, offender populations are always reluctant, they are resistant, ambivalent. So the way it is designed, it is so practical that they can easily participate. The foregoing evaluation document their efficacy. We'll see from cost benefit side. In 2010, an analysis of cost benefit of R&R by the NICE concluded that NICE is a National Institute of Excellence Guidelines. UK concluded that the reduction in the recidivism rates by providing R&R to adult offenders results in an overall net saving of £232 per adult offender over 1 year. So it reduces huge cost of. The cost benefit analysis also concluded that R&R can potentially lead to a reduction in other costs also. So healthcare cost and emotional distress of victims. It also reduced the emotional distress of victims. We can see here, especially in our country, there is no particular system to target on victims' problems. So this also reduced the financial and economic burden to the families of both victims and offenders, because if they are not committing repeated offenses, so it will reduce both say and the feeling of fear and insecurity of anticipation of crime. So in 2010, group-based cognitive and behavioral interventions such as reasoning and rehabilitation as the key priorities for implementation, NICE has recommended in 2010. I will also put here 2006 a meta-analysis which says this was conducted in Cambridge University that say that there was a significant 14% decrease in recidivism for program participants compared with controls. So it was control trial. It was effective in community and institutional setting, and for low risk and high risk offenders, it can be applied on both high risk offender as well as low risk offenders. Smaller and larger evaluation studies and older and newer studies have shown the program was effective. So this was from my part. Now I will call upon Dr. Amory Clarke, so he will continue for the techniques and methods in reasoning and rehabilitation program. So,
okay, hello everyone from London. I'm pleased to be with you, and I need to figure out how to share my slides, which we practiced yesterday. So I think I know how to do it. So I hope you can see my slides. Can somebody confirm that you can?
Yes, sir. Yes, sir.
Oh, brilliant. Okay, thank you so much. So, offenders commit crimes for many reasons, and you all know what they are, so I'm not going to dwell on them, but they like adventure, they like excitement, they find many situations boring, they think obeying the rules is boring, and often, at least in the West, they do it because of hypermasculinity, the sense of being a man, but often it's because they want something. And they want it now. And that's a significant problem. So what the scientific literature shows us is that they tend, in general, offenders, as Mahesh said, they tend to have problems with impulsivity. They're not good at solving problems in their lives. As Mahesh said, they have problems with self-control. They have problems with emotion management. They have problems with decision making. I mean, these are quite common sources that drive criminal behavior. And so R&R builds on the foundation, builds on the premise that offenders suffer from a social cognitive skills deficit. They tend to be under-socialized, and they often lack the values, the attitudes, the reasoning, and social skills that are required to function effectively in the world. And the basis of R&R is that these skills can be taught. This is the foundation of R&R. It's a skills program. Sometimes it's referred to a cognitive behavioral program, which it is, but it's really a skills program. So basically, these skills are things to help people get what they want in life, whatever they may be. It's really what we all need to be successful in life. I personally find that every time I deliver R&R, that my thinking gets clearer and my problem-solving ability improves. In other words, yes, we use it for offenders, but it's good for life in general. These are life skills in many ways. So I'm not going to run through this. This is just a characteristic of offending programs in general. They tend to be structured and manualized. And this is a very important part of R&R, that there's a detailed manual. And adhering to the manual is very important. Now, one of the things that I'm personally acutely aware of is the fact that you will be delivering this in India, and India is a different culture, and so you do have to adapt it to your culture. And so I'm saying, on the one hand, it's a very structured program, and you need to adhere to the manual, but on the other hand, you need to adapt it to your situation and the situation you're in. But it does have a very strong social learning component, which is really a kind of behavioral therapy in the cognitive behavioral sense. Sorry, my slides aren't transitioning. Oh, there we go. So it's not just cognitive behavioral therapy. So you start out really right in the beginning with the social learning aspect of it. And there's emphasis on role play, which is a critical aspect of the program. This is what takes it beyond the cognitive. And role play is not just play. I mean, this is very serious. But it's also a kind of tricky aspect of the program, and particularly in the beginning, you need to get this right. Because often, if you ask people to do a role play, they will often say, "I'm not doing it. I don't like it. What do you mean?" And so you need to make sure you set it up properly in the beginning. But I can say from many years of experience that role play is an extremely effective way of bringing about change. I have run groups with offenders, and I look out at the group and I can see they're all bored. They're not interested in what I have to say. They're falling asleep. I call on them when they fall asleep, but I can still see I won't get them. And then sometimes I'll do a role play, and within less than 10 seconds, the entire room is electrified. In other words, role plays are fun. I mean, they're really fun, and the participants really enjoy them. And it's one of the aspects of the program that many of the trainers struggle the most with. They think, "Oh, I don't know how to do that," or "Not sure how to do that." But it's extremely important. So it's as Mahesh says, the role plays are fun. They're also, it's not just play, it's deadly serious. They're very stimulating, it's active, it's serious fun. So here's an example. Now, this is just an example of the kind of fun thing that we present to the offenders, and we ask them to solve it. So I would just like you to look at this. I mean, I'll read it out. A dead woman is found in a desert. She is lying face down. She is wearing a pack on her back. How did she die? And how did she get there? Now, it's very important to emphasize that you can solve this problem. And I could help you to solve this problem right now if we weren't doing a video. But it's a little bit more difficult on a video lecture, because this is and the reason why is you can't be Socratic. I mean, the first cognitive skill is to ask questions. You need to gather information. You need to consider all the facts, and you can't do that on video. So I've heard Professor Ross say you don't want to give people the answers and you want to build up the frustration. But I am personally of the view that I need to give you the answer now, rightly or wrongly. So I'm going to tell you the answer. So the answer is that her parachute failed to open and she jumped from a plane. Now, that is not an issue that is solved through intelligence. That's an issue that is solved through cognitive flexibility. So, as I said before, an important cognitive skill is gathering information. And one way to do this is to ask questions. And it's important to emphasize this is a very active program. They don't just sit there and listen the way you're doing right now. They are involved. They are jumping in. They're asking questions. They're holding up their hand. They're shouting for answers. It's very stimulating. That's the whole purpose of the program. And the Socratic style, which they talk a lot about in cognitive behavioral therapy, is an important aspect of this. So with a problem like this, what I'm arguing is anyone can solve it, but you have to help them. And that's where the Socratic part comes in. You need to get them to ask questions. And you say, "Oh, that's a good question. You're getting warmer." "No, that's not. You're getting cold. You're getting cold." And you can induce people to answer the question to solve the problems, as Mahesh says. You know, we need a precise model for the implementation of problem solving. And that's what these things do. And then I'd just like to emphasize that to teach, in the original Greek sense of the term, it did not mean to put in, it meant to draw out. So this is really what you're doing in R&R. You're drawing out answers. You're encouraging people to think, to problem solve, to be active, to practice skills in role play. I'll do another one. A lady with a shovel is digging a hole in the ground. She is surrounded by a cheering crowd. Why is the crowd cheering? Now, I'm here to tell you, every one of you watching this can solve this problem. It's not obvious. If we were doing R&R, I would encourage you to ask questions. You would ask questions, and you would solve it. You do need to be very careful when you're doing this, because there's often some people, some offenders who are very good at solving these problems, and they'll shout out the answer. And you need to get them to raise their hand if they think they know it, or maybe write it down or whisper to you, so that everyone has a chance to problem solve this on their own. But the answer to the question, because I can't Socratically get you to answer it, is the lady is a mayor of the city. and this is a groundbreaking ceremony for a new building. So these things are fun. The program is fun. The program is stimulating. And it's not just a cognitive program. It's not just CBT. I mean, it is cognitive behavioral. It is a cognitive behavioral skills program, but it's more than that. It's a skills acquisition program. So you start off right from the beginning. I'm going to skip over this. You start over right from the beginning saying that you're going to go from automatic thinking. Now, all of us engage, particularly offenders, engage in a large degree of automatic thinking. And we can become more skilled in our thinking. But what we're aiming for is skilled automatic thinking. That's one of the goals of the program. And as we said, this is all part of being lively and stimulating, is that it's, we do these kinds of exercises, we have group discussions, we do all kinds of role plays, we do neuro aerobics, brainstorming. You put up a problem and you just get everybody shout out anything they can think of, and you just write all the answers down. So it's fast-paced, it's active, it's fun. The difference now, Mahesh talked a lot about the R&R, original R&R program, which I've done a lot of. The difference between R&R and R&R2 is that R&R2 is shorter. And Ross and Holborn are arguing that most participants will require, they will require a briefer program. You can make it longer and you can tailor it to people's needs, but they often can do shorter versions, and the second version is shorter. But one of the big differences between, it's not big, but it's a difference between R&R and R&R2 is the focus on Edward de Bono's 6 thinking hats. I've got to. Okay, so the first
Participant, switch off the camera. You are disturbing the presentation.
Yeah, somebody needs to turn off their microphone.
Sir, wait a minute. I'm telling him. This Jilin Sharma ji, please. Yeah, thank you so much, sir. So you can start now.
Thanks, Raghi. So the first sentence of the 2017 edition of this book says, the 6 thinking hats method may be the most important change in human thinking for 2,300 years. That's a very big statement, and I don't dispute it, but it's a big statement. It's important. Let's put it that way. De Bono argues that the main difficulty of thinking is confusion. And this is all of us, not just offenders. We try to do too much at once. Emotions, information, logic, hope, creativity, they're all crowding in on us. And we're just juggling too many balls. We've got too much going on. So the De Bono's idea is that we need to break thinking down to 6 basic areas. So beginning in session 2, you put on a colored hat to focus on the thinking process. And I'm going to demonstrate this by putting on my blue hat right now. And this is a way of emphasizing a certain kind of thinking. So each of the hats displays different kind of thinking. And baseball hats are very good because they got a visor and you can put them on and off. And I've got a red hat here, but the problem is it's a pullover hat. And then I've got a black hat. It's also a pullover hat. And that works okay. But I have to say, for doing the training program, particularly when you're taking them on and off, a baseball hat with a visor is the best way to go. Just a pointer from experience. But it's really, these hats serve as a reminder, am I thinking well? So, as I've already said, the problem is confusion. We're doing too much at once. We have too many balls in the air. And the solution is to use the 6 thinking hats method. Now, some of this is based, in the original R&R program, there was an entire module on creative thinking. And it had these 6 basic skills in there. And they're a core part of the program. But it's developed a little bit more in R&R2. R&R2 is shorter, puts more emphasis on the 6 thinking hats. And these can be very, very powerful. Just to tell you a quick, well, maybe I won't. Let me get through my slides and not digress. So the white hat, this is the facts. What can we agree on? So this is the first hat you use when you're solving a problem. The red hat, this is about feelings. It's often gut feelings. It's often enthusiasm. The green hat, this is alternative. It's creative thinking. The yellow hat, it's what are the benefits? Is it a good thing to do? What is its value? The black hat, this is the hat of caution and judgment. Will this work? This is an important hat because it's important to slow down. Impulsivity is often a big problem with offenders. And so putting on the black hat is a way of slowing down your thinking and saying, do I really want to grab that apple off of the cart? What's going to happen if I do that? And the blue hat, which I'm wearing right now, this is reflection. How am I thinking? And that's why I'm wearing the blue hat. Because I'm trying to give you I hope you can see this. I didn't check it, but it is a blue hat. And so the idea here is getting the big picture. And that's what I'm trying to do today. I'm trying to give you the big picture about how to implement R&R, giving you the big picture. So in the very beginning, you display all 6 hats. And then you talk about some of the skills involved. So in R&Rs, these are the R&R sessions. The first session is skilled thinking, feeling, and behaving. The second session is managing thoughts and feelings. Third session is another session of managing thoughts and feelings. And then you get into scanning for information, a very important skill. Fifth session is recognizing thoughts and feelings in others. Listening skills and listening with empathy. That is if you want to succeed in life, knowing how to listen well is vital. Thinking of solutions, consequential thinking. This is a big problem. This is where many offenders get into trouble. They don't stop and think about the consequences. Evaluating the thoughts of others, evaluating your own thoughts, moral emotions and values enhancement, making wise choices, negotiation skills, and then the final session is desisting, stopping doing something. So what does this have to do with the hats? Well, each of these skills is related to one of these hats. The second session, managing thoughts, this is the red hat and the blue hat session. So it's thinking about your feelings on the one hand with the red hat, but then you also want to get the big picture. Feelings are important, but if you're completely emotion-focused in your thinking, that can be a problem. And so it's important to have a balance between thinking and feeling. You need a balance between the red and the blue. And the first session 2 and session 3 are focusing on getting that balance. And then, as we say, we go on through the various sessions applying these skills. So the hats, this, as I say, is one of the big differences between R&R and R&R2, is the emphasis on the hats. And it's a good idea to wear the hats because it's a way of showing the offenders that you're engaging in a certain style of thinking, which will clarify the thinking, I would argue, for all of us. I mean, when BONO developed the 6-hat model of thinking, he did not develop it for offenders. He developed it for business leaders. He developed it for people who manage agencies. He developed it for, he wasn't thinking about offenders at all. But one of the findings that Dr. Ross came to, Professor Ross came through after doing, looking at the literature on neurocriminology, is that the 6-hat model maps well onto R&R2. In other words, R&R2 has adapted this model. Hopefully I can get to the next slide. It's not transitioning. I don't know why. Okay, so it's, as we say, the white hat is neutral and objective, and it's concerned with facts and figures. The red hat is the emotional view. The black hat is being careful and cautious. It's the devil's advocate approach. The yellow hat is being sunny and positive, being optimistic. You know, if you've read Seligman's book, The Hope Circuit, you know, he is in some ways the driver of cognitive psychology. You know, he was the president of the American Psychological Association, and he said one of the problems with psychology is we focus too much on what's wrong. We don't focus enough on what's right. So the yellow hat is very important. Being positive, believing you can solve problems, believing offenders can change. The yellow hat is very important for that. The green hat is associated with creativity, with fertility and growth, generating new ideas. So when you're brainstorming, you'll put on the green hat. Unfortunately, I left my other baseball hats in the office, so I don't have my green hat with me. But the green hat is for generating new ideas, creativity. And the blue hat, which I'm wearing now, is the cool thinking, blue skies thinking. Above everything else, it's the organizing hat. And that's why I'm wearing it today, because I want to give you an overview of how to implement R&R. So the blue is the big picture, the white is the facts, the red is feelings, black is critical judgment, yellow is positive thinking, the green is new idea. And the techniques are, for blue, is consider all the facts. And then what are the most important factors here? The first important principles. The white hat is about gathering information. Often all of us don't gather enough information. The first half of effective problem solving is problem definition. You need information. You need to define the problem. So the white hat's very important. But feelings are important too. You know, emotions are what drive us. It's the engine of life. It's where our passion comes from. So, but if we're too emotional, we get in trouble. The black hat is critical thinking. This is slowing down and thinking. You know, plus minus interesting is one of the skills you do here. So I'll just tell you very quickly. I was running a group with a very rigid offender. I mean, he said, "This is stupid. I hate this program. What am I doing here?" And we put up a problem saying all marriage contracts should be renewed after 5 years. In other words, the marriage is null after 5 years unless the couple renew it. And he said, "That is so stupid." I mean, he was really being very belligerent and very difficult. And anyway, we did it. We said, what is the positive things about this? And then everybody brainstormed, and then we said, what are the bad things about this? And the group brainstormed and they came up with different answers. And then we said, what's interesting about this? And before we did this exercise, we took a vote. Who thinks marriage vows should only last for 5 years is a good idea? Who thinks it's a bad idea? And we wrote their names down on the board. Or I think I kept a list beside me. And this guy who was being so critical, he was saying, this is stupid, this is ridiculous, that's stupid. We did the exercise, he didn't engage in it very well. And then at the end, we asked the question again, who thinks this is a good idea? And he had completely changed his view. And he said, that is so cool. I mean, he was just amazed that his thinking had changed. He was one of the most rigid people I've ever worked with. Through R&R, we were able to break through that rigidity using PMI plus minus interesting. Yellow hat, again, positive, again, a good place to use PMIs. And the green hat, this is for new ideas about creativity. So the underlying principles, the 6 hats, are that the human brain, we think in a number of deliberate ways, but we have to improve the tactics of our thinking. So BONO identified 6 distinct directions in which the brain can be challenged. We're really trying to develop new pathways. We're trying to lay down new pathways. That saying that history repeats itself and those who don't know history are condemned to repeat it. Well, we don't want people repeating their same history. We don't want them learning new techniques. So really what the 6 thinking hats are is identifying different ways of thinking, using different hats, such as the blue hat, which I'm trying to do today to give you the big picture, to help people improve their ability to solve the problems in your life. So the white hat is facts and figures. How am I going to get this information? Where am I going to get it? What information do I lack? My slides aren't, there we go. Just the fact, please. And you don't want to get into a lot of argument here. You just want to say, what are the facts? And try and get, the white hat thinking is just information gathering to a large degree. The red hat, as I say, is about feelings, emotions. It's I like it, or feeling neutral, or uncertain, or doubtful, or unhappy, or I don't like it, and so on. I mean, these feelings are important, and we need to include them in. And I think this is an important point. The expression of feelings may vary from culture to culture. I think that, for example, in Japan, feelings are expressed in a very low-key way. I was born and raised in New York City. I'm from New York. I tend to be quite demonstrative in my presentation. The English don't tend to be as demonstrative. And so there are cultural differences, and you do need to consider those and take it into account. Americans, I must say, people from the States and North America, they do tend to be a little more direct as well. They'll say that's a lousy idea. The black hat is being cautious. It is the most useful of all the hats. One of the original R&R programs was called Stop and Think. And it was an adaptation of R&R. It wasn't exactly R&R. It was developed by Peter Rayner here in the UK, and he basically argued that that's what the program's all about. You just need to stop. You need to control the impulsivity. That impulsivity is the most important thing to target, and that's what the black hat does. It teaches us, all of us, but particularly offenders, to control their impulsivity, and it's perhaps the most important hat. It's the hat of caution. It's being careful, slowing down. Stops us from doing things that are illegal, dangerous, unprofitable, polluting, and so on. It's the hat of survival. And I have to say, I mean, I'm very interested in compassion-focused therapy, and it teaches you to be more compassionate toward yourself, to realize that you do need to have this flat hat thinking. So the yellow hat is positive, but it's also speculative. It's like, how can we come up with new ideas for solving this problem? So think of sunshine, think of optimism. So, you know, it's being open-minded in your thinking. And a lot of us can be rigid in our thinking. And so the yellow hat is about opening up your thinking. You're trying to think about different solutions. And it's amazing how all of us get into bad habits. All of us, myself included. We can get into bad habits where we start thinking in a certain way. And the advantage of the six hat approach and R&R is that it teaches us, all of us, but particularly offenders, new way. The yellow hat is a harder hat to wear than the black hat because it requires quite a bit of creativity. And as I say, there's a natural mechanism in the brain that keeps us to avoid dangers. Now, many people who are offenders are thrill seekers. You know, they say when life gets boring, they like to commit a crime. So there's not a natural mechanism for the yellow hat. And most people are a little bit better. Well, most people, I say most people, certainly not most offenders. The green hat is the hat of creative thinking. It's the hat of energy. Think of vegetation. Think of growth. It's a way of putting forward new ideas, thinking about different options and alternatives. The blue hat is control of thinking. The blue hat, which I'm wearing now, giving you the overview. Blue sky thinking about how we do this process. Wear the blue hat when we were no longer thinking about the subjects. Instead, we're thinking about the thinking that we need. So I'm wearing the blue hat because I just want you to think about these six hats. I want you to know that they are a part of the program. I want you to know that this is a useful tool for all of us. And I'm hoping that you will remember at least the six hats. So you could almost think of this as dendrites in the brain, the branches of the brain. We're trying to, from a neurocriminological point of view, we're using the six hat approach to thinking to develop new dendrites, to develop new ways of thinking and new ways of solving problems in life. This is what the six hats do. So I don't know why my slides clicked off there, but BONO shows us that we can all become, sorry. Anyway, I could stop there, I think. I think I've used up most of my time. Let me just make this one final point. Sorry about this. Let me quickly go through my slide. I don't know why I can't get to where I left off, so I'm just going to go through these very quickly. Sorry about this. How annoying. So I want to go to this slide just because I personally think it's an important point. Oh, dear, dear, dear. I don't want to do this. Okay. Nah, I won't do it. Anyway, it's, I think maybe I'll stop there because I can't get to the slide I want. All I wanted to say is that I think when you present these exercises, it's important not to you want to improve their self-efficacy. So every time you present a problem, you want to tell them you can solve this problem because a lot of them have an external locus of control, not an internal locus of control. So every problem you present them, you want to believe, you need to develop problems that they can solve. So I think I'll stop there and turn this off, and hopefully I can get back on. There we go. Okay, so
thank you, sir. Thank you so much. Now we'll move ahead and take some time for the questions. So, sir, first question is from Suchita Rawat. Sir, is the RNR program specific for a batch of offenders based on the severity of the crime they committed? And the second question is, are the offenders tested for psychometric test prior and post the RNR program?
I think it's a very good question, Mahesh. What do you think? Do you want to provide an answer to that?
It is necessary. Yes. It is necessary. We are applying HCR is necessary, like pre-post assessment. So as a pre-assessment, we are applying HCR 20. And hello, I'm audible?
Yes, sir. Yes, sir. You are audible. Yes, sir.
Okay. So we are.
As Mahesh says, I think it's very.
Yes, Amory.
These programs are expensive to run, and they're expensive and they can be a little bit complicated to deliver, and the training's expensive. So it's important. I think Mahesh makes a good point. You need to do pre and post measures to show change. You need to show value for money. I think that it's, in general, good practice to do pre and post measures. And I think the first part of the question was about the seriousness of the crime. These are important skills, and there's no reason they can't apply to everyone. So I don't think, there's some debate about whether or not you should exclude people who have a high score on Roberts-Hare's psychopathy checklist. And there's some argument that primary psychopaths, and I looked at the literature, I couldn't find a lot of studies looking at psychopathy in India. But there's some debate about whether or not it just teaches them to be more skilled manipulators, but I don't know.
Okay, so next question is from Dr. Shweta Sharma. Is there any timeline for getting the results after RNR has been implemented? Am I audible?
So this question is from me?
No, not the name has been written. So anyone can of you answer.
Okay. So what is her question? She want to know how will come to know about the
results. How will I know?
Just repeat it.
Is there any timeline for getting the results?
No, it's not like timeline. When we are already defining the sessions are already scheduled and designed. So after the completion of whole session, we'll apply once again HCR, the test. So post test. So post test will show the benefit, the reduction in recidivism. So the pre-post design is scheduled already. We planned how much session we are going to take. How will the delivery, and finally means already we are planned each and everything. So the pre-test, whatever we are doing as a pre, will apply on post, after post intervention. So we'll get the results.
Sir, next question is from Shweta Sharma. Does higher cognitive skills has any relation with recidivism?
Yes, the research shows that the people who are repeated offenders, especially recidivisms, people are lacking in higher cognitive functionings. And neurobiological research has shown that cortex region mein prefrontal cortex areas are lacking. And amygdala is also, the size of prefrontal cortex as well as amygdala is little less than normal people. So in that way, they are unable to, as we know, the frontal cortex is responsible for higher cognitive functionings. So in that way, they are lacking in that area.
And I would answer that question saying yes. These skills can be taught.
Okay, so sir, as we have streaming live on YouTube, also some questions are there also. This question is from Yashpreet Singh. Criminals are in general low in agreeableness and high in neuroticism. So how to change their behavior? They are low in openness to experience and consciousness.
That's a very good question, because I think really one of the skills that you're trying to teach is open-minded thinking. You're trying to break down the rigidity of thinking. And yes, you're right. Offenders in general they tend to be rigid in their thinking. They tend to be rigid in their problem solving. They tend to be rigid in their behaviors. They've learned a certain way to do things, and they're going to keep doing that. What R&R teaches is to be open-minded, to see that there are different ways of solving a problem. So it's one of the things that we're directly targeting.
Okay, so it's look like we have covered all the questions. So speakers, do you want to add anything else before a wrap up?
Some more questions are there, Ragini Jassi.
Yes, sir. Now, this question is from Abhilasha. Since psychopathy was mentioned, apart from other skills, empathy be developed in them?
Once again, I didn't get.
Okay, since psychopathy was mentioned, apart from other skills, can empathy be developed in them?
Can empathy, is that the question? Can empathy be developed?
Yes.
Yes. The answer is yes. Yes.
Okay.
R&R targets empathy.
So
you can definitely teach cognitive empathy, but the new literature is showing that you can teach emotional empathy as well. So the answer is a definitive yes to that question.
Okay, sir. So we have covered all the questions. So do you want to say anything else before I wrap up, sir? Both the speakers?
I think that it's important to realize that it's need to be delivered by a team. I personally think that in some ways you are only as good as your team. You need to get feedback from each other. So you need to get your colleagues to sit in and watch you deliver R&R and give you feedback after the session. You need to debrief after the session. You need to view the videotapes and show, are we helping the offenders we're working with to learn new skills? And I think that's a very important part of the program, which needs to be emphasized. Did you have anything you wanted to say, Mahesh?
Yeah. I would also add upon certain things. Like the thing is, when we are applying this program, we need the people from prison department, like especially jail superintendent or prison officers who are involved in certain activity with these criminals. If they are brought into the team and they are working together, it will be more effective. And certain things we need to, like, as you know, Dr. Amory, India is a very vast like socio-cultural background. So people are from different cultural backgrounds. So we need proper input from the those prison departments. So involvement of, as you told already, the teamwork. So it requires team, where the people from the prison department is highly required. They need to be part of such team when we are providing such interventions.
Sir, we have two more questions actually. This question is from Hetal Jani. As we are talking about neurocriminology, the BEOS, fMRI, and EEG also came in picture. For knowing the suspect participation in the scene of crime, will these techniques will also be considered here?
It's a good question, but thing is here this program is especially for intervention. So already people are offenders. Suppose they are offenders, they are sentenced in prison. So we are seeing their the cognitive cognitive, their thought process, their what type of thought process they are having, why they are doing crimes. So basically, we are trying to teach them by this cognitive behavior model, reasoning and rehabilitation, okay, how they can get rid from such type of thought process. So here we are not trying to find out the causes behind the crime. The other, that sociological perspective which as a criminologist are seeing, we are therapists, we are trying to mold it, modify their thought process, their other things. So these techniques are mainly used to find out certain causes, the relationships. So
Well,
in that way, yes sir, please.
Yeah, I would I think that's a good point Mahesh makes. I mean, this is not therapy, and you don't talk about the rape, the assault. You don't talk about the individual offense. This is about skills acquisition. This is about learning new skills. So it's that's an important point.
Okay, so as we are running late, so only one question will be accepted. Okay, this is from Sai Teja. The question is how to deal to multiple personality disorder criminals.
Was that about multiple personality disorder? In other words, dissociative identity disorder?
Yeah.
Multiple, it's multiple, yes, sir.
Well, I mean, that's a hard question to answer. I mean, I just had a patient I work with who has dissociative identity disorder, as we call it now, that I've been working with. It's a very complicated thing. It's still about learning skills, and so I would answer that question by saying it doesn't matter. It's still teaching the skills.
But I think I need to add something. It's a question from Sai Teja. So in dissociative identity disorder, I personally believe that first need to work out about his personality disorder, especially dissociative identity disorder. There should be at least one personality where we are going to intervene. So I think he need first the proper treatment for this dissociative identity disorder, and then only this program can work in better way. Because which personality we are teaching the skills, we don't know. So in that way, I think personally believe, sir, they need first the treatment of particular personality disorder, then they can be involved in this program, recidivism program.
I would agree with that.
Okay, so it looks like we have covered all the questions. So thank you so much, speakers, for your valuable time and information. It was really, really, really a great session with you. And yeah, one thing I want to add that, if I, being a non-psychology student, was able to understand each and everything during the whole lecture without any query, that means appreciation is really yours. So, because if you are explaining science to a non-science background person, it's really very difficult, So, but teachers like you, teachers and presenters like both of you did this job with great ease. So I must appreciate your teaching skills and presenting skills. So thank you so much for joining us today to, connected with us. Thank you so much.
Thank you so much. And thank you for coordinating.
Thank you.
And thank you all for all your attention, and I hope to see you soon.
Before ending the session, let me take the chance to thank everyone who were involved in making this event successful. So, especially I would like to thank Dr. Sumit Kumar Chaudhary, Dean, School of Forensics and Risk Management, RSU. I think without whose guidance, this would not have been possible, right? Also, I would like to thank faculty and all the students who worked hard, are working hard to make every event of our department go this way. And also, in last but not the least, I am very thankful to all the participants out there who, attended whole lecture with great enthusiasm. We hope you found this lecture informative and, informative and very useful. So please, for such more events, please stay connected with us. Stay tuned with us. Okay, so now I will call upon Mr. Sudhanshu Shekhar Tiwari, sir, to present the certificate of
Yes,
Yes, sir,
whatever.
you are audible.
Thank you. Thank you. Thank you. Thank you, sir.
Thank you so much. Thank you.
Thank you, Amory sir. Thank you, Sudhanshu sir. Thank you, ma'am. मैम आपके सुमित सर
Hello, Tripathi sir, how are you? Hello, ma'am, how are you?
Fine, sir, fine.
Ma'am, thank you so much. Your seeds are now growing, and see, today we have done a webinar
I'm
on your,
very happy about it. Very, very happy.
and we are happy to see you here.
Yeah. I was to attend.
Thank
See,
you.
if somebody is doing something that we have started, I'll be very happy to attend.
Actually, I got